So our group's topic is the HalluxAbductusValgus, or a bunion, more commonly known as, and its anatomical deformity and implications. So what is a HalluxAbductusValgus, or a bunion? So HalluxAbductusValgus is an issue that is more complex than simply a problem of footwear. The hallux, or big toe, is made up of two joints, an interphalangeal joint and a metatarsophalangeal joint. The metatarsophalangeal joint is located between the first long bone of the foot, the metatarsal, and the first bone of the toe, or the phalanx. A bunion is considered an enlargement of the bone or tissue around the metatarsophalangeal joint of the hallux. A bunion is a valgus or lateral deviation of the hallux or big toe at the metatarsophalangeal joint. A bunion is considered to be a progressive foot deformity as the metatarsophalangeal joint is gradually subluxed over time. This causes the first metatarsal to abduct while the phalanges adduct. This often causes the bursa that surround and cushions the joint to become inflamed and the entire joint to become stiff and painful. A bunion's cause is multifactorial in nature, with each individual case being hard to define. So we're going to show you a video of how a bunion on the foot progresses over time. So as you can see, bunions can cause the toes to shift over time, leading to poor foot alignment. So as I said before, a bunion is a valgus or lateral deviation of the hallux or big toe at the metatarsophalangeal joint.
So some statistics about bunions is that they're considered to be the most common forefoot deformity, with an estimated global prevalence of 23 to 35% of people. And middle-aged and elderly people, are predominantly women, are also found to be the most affected. That's due to women are commonly found wearing high-heeled shoes that are more narrow, and that is caused to increase the problem. Also, some occupations are more susceptible to bunions. These are occupations like dancing, nursing, and teaching that force you to be on your feet for a long period of time. Some causes of bunions are flat feet, hereditary factors, wearing shoes that are too narrow, overly long big toe, also called Egyptian foot, ligamentous laxity, which is overly flexible ligaments, high arches, and an overly mobile foot. Due to high arches, they collapse when walking, putting more pressure on the area that causes a bunion. Pregnancy or menopause, which also causes your arches to collapse due to carrying the child and the heavier weight. Various mechanical factors such as hyperpronation, hypermobility of the foot, your arch too high or too low, and then, like mentioned before, occupations that involve standing on your feet all day.
Some of the main signs and symptoms of bunions located in the specific region on the big toe are pain or soreness, inflammation and redness, a burning sensation, possible numbness, ingrown toenail, and the big toe can lean towards the second toe. Also, all of these signs and symptoms can vary from patient to patient.
This slide lists some common implications of a HalluxAbductusValgus. Individuals with this condition may have trouble bearing and distributing weight in a variety of body mechanics like squatting and dorsal flexion. Additionally, bunions on the big toe can lead to damage of the other toes. With pressure from the big toe, the others may develop a bend in the toes called hammer toes. Bunions may also lead to corns, which are calluses on the anterior aspect of the toes. The picture to the right gives an illustration of how the big toe affects the others and what these additional deformities may look like in practice. Ingrown toenails and calluses on the bottom of the foot are common with bunions. Constant shifting from the metatarsophalangeal joint to the other metatarsals may cause metatarsalgia, or discomfort and swelling in the ball of the foot. Lastly, individuals with bunions may experience pain in other parts of their bodies because they have to compensate their gait patterns. Some common areas where pain is displaced from bunions include hip, knee, and lower back. Since a bunion may cause a number of implications, it also impacts certain activities of daily living or instrumental activities of daily living. This may impact an individual's lifestyle, especially if they are on their feet for most of the day. Some activities that may be included that are affected are walking and running, difficulty wearing shoes, dancing or exercising, pressing the gas or the brake pedal when driving, or any activity that requires plantar flexion. Lastly, showing off your Michael Jackson toe standing moves at the next Halloween party would be impacted, cause lots of pain, and be a major party foul.
Each different case of a bunion varies from person to person, and some are more severe than others. More severe cases require treatment, including non-surgical treatment and surgical treatment. The types of non-surgical treatment include changes in footwear, padding, activity modifications, medications, icing, injection therapy, and different types of orthotic devices. The surgical treatment involves the removal of the bump of the bone and correct bony structure and soften tissues.